Good afternoon, everyone. I am Daniel, representing Life Trust India. It's my pleasure to welcome you all for the first webinar of the second series for the year 2025-26, titled Wildlife Disease Investigation. The theme of this first series is elephant health in Asia, a critically important subject, giving the growing interface between wildlife, livestock, and human populations, and the increasing recognition of disease as a key conservation and management challenge. This webinar series aims to provide a platform for sharing knowledge, experiences, and practical insights related to disease detection, investigation, diagnosis, and management in wildlife. Through this series, we hope to strengthen the interdisciplinary understanding among researchers, veterinarians, conservation practitioners, forest officials, and students. We are delighted to have participants joining us from different regions and backgrounds, and we hope the series will encourage learning, dialogue, and collaboration in the field of wildlife health and conservation. Before we start, I'll have some instructions. Please keep your microphones muted throughout the presentation, and the video may remain switched off unless required. Questions can be posted in the chat box, and all the questions will be taken up and answered at the end of the presentation. The session will be recorded for academic and educational purpose. The session will be recorded, as I mentioned. Participants are encouraged to stay until the end to benefit fully for the discussion. Once again, thank you all for joining us. We look forward to engaging an insightful session on wildlife disease investigation with a focus on elephant health in Asia. Now, I hand over the session to Dr. Heidi Riddle, chair of the IUCN SSC Asian Elephant Specialist Group, and also who is representing Asian Elephant Support. Over to Heidi now.
Thank you, Daniel, and welcome everyone on behalf of Asian Elephant Support. Welcome to this webinar. We hope that you find it helpful and also are able to then connect with other veterinarians in your field of work. We would like to start the first presentation, and I will introduce the presenter. The presenter is Dr. Kalaivanan. He has worked in the field of free-ranging wildlife in veterinary care for 24 years in the Tamil Nadu Forest Department as a forest veterinary officer. Dr. Kalaivanan has experience in wild animal rescue and rehabilitation, human-wildlife conflict mitigation, and wildlife health monitoring. The title of his presentation today is Sharing Experiences on Health Monitoring Protocols in Free-Ranging Elephants and Other Wildlife. So, Dr. Kalaivanan, welcome, and please start your presentation.
Yeah, good morning, Heidi. Is audible to everyone?
Yes, you're audible.
Yeah.
Yes.
Okay. Yeah. Thank you so much. Thank you for the opportunity. So this is very simple presentation about my little experience in wildlife diseases and wildlife health monitoring. So this is actually one of the neglected aspect as far as concerned in our nation, because this wildlife department belongs to forest department. So veterinary department no access to do any research work, anything. So even if any research institute do any work, it's we have to go through a lot of legal constraints. There are developed protocols available for domestic animals, but the same can't be replicated in the wildlife, free-ranging wild animals, because there are the legal issues. So we cannot do active health, wildlife health monitoring, because not like Western countries, we cannot touch the animal. So we have to do health monitoring based on the non-invasive technique mostly. So with my little available knowledge, so there are actually veterinarians working with a department like me. They are working on deputation from the animal department. So mostly the veterinarians are engaged one of our mitigating man-animal conflict, rescue and rehabilitation. Very less time actually we work with the wildlife health monitoring. Otherwise, mostly we engage with wildlife rescue and conflict mitigation things, because there are a lot of news, emotional, sentimental news in the news medias. So we are actually going behind the sentiment. We get very less time to do the work, real veterinary work. So this is actually one of the important aspect as far as free range wildlife concerned. It's one of the neglect aspect. Next, please. Next slide. Yeah. So mostly, if you actually list out the threats to the ASN elephant conservation, so like beside poaching, habitat degradation, sinking of habitat. So the main thing actually man-animal conflict. So we are actually taking all measures to control, to mitigate man-animal conflict. So because of the conflict, the interface actually between wildlife and livestock and human actually increasing. So actually we are only taking care of the mitigation measures, but when an animal comes out or people go inside, there are a lot of spillover pathogens on both sides. So actually there are hidden pathogens inside. Actually, it may cause a lot of diseases if actually not properly handled or properly study those things. So we may face a lot of consequences in future. Next. Yeah. So because of this conflict, so now actually we started recording tuberculosis, mycobacterium tuberculosis in elephants. So near to Mudumalai in Wayanad border, actually in the Wayanad Mudumalai landscape, actually we have recorded 4 cases of since 2007 cases of tuberculosis, the mycobacterium tuberculosis. Mostly the elephants which are moving out, coming into conflict, young individuals, that actually affected with the mycobacterium tuberculosis. That is actually very alarming signs. So because once this infection has spread inside, it may affect all taxa. So that may leads to serious consequences in the wildlife conservation. Next. Yeah. So we know the ancestor of present day ASN and offering elephants. So mammoth, mastodon. So why this mammoth or mastodon extinct? There are a lot of theories, like habitat, degradation, global warming, hunting, all those things. But there is one theory is that the mastodon, American mammoth, actually extinct because of the tuberculosis. Because out of 113 bone, the scientists discovered 53 bones are positive for mycobacterium tuberculosis, bacilli. So that indicate, they actually speculate that the mycobacterium tuberculosis would be one of the reason for the species extinction. So the disease has that much threats to the conservation. So not alone habitat management conflict, the disease also could be one of the threats in future. So if we want to conserve our population, so we have to really do the health monitoring. We have to find the root causes. We have to do the proper wildlife management. Next. Yeah. So wildlife health monitoring, it should be a regular exercise in protected areas. So unfortunately, such a program rarely form a part of regular management. So the people actually, when we are actually doing this kind of worrying about wildlife health disease, whenever there is epidemics occur in the population. So only in those things also, only few infection manifested as diseases. Many are not obvious immediately. Most prevalent disease syndrome is malnutrition, starvation in the wild. So mostly we are only concentrating that only infectious diseases only is a disease. We are actually leaving other things easily. Next. Okay. So what is the wildlife disease itself? The meaning is different. Wildlife disease has been defined as any condition which jeopardizes the survival of an animal in a particular environment. So this is a broad definition, but one most useful in considering diseases of wildlife. So not only infectious diseases, any condition which affect the health of the animal, that is called as wildlife disease. Next. Okay, so why to study this wildlife disease? So because in case of ranging wildlife, the treatment of individuals is not possible. So only the preventive measures are far most effective means of dealing with the diseases ranging free living animals. So diseases in a wildlife population is rarely simple. One cause, one effect situation. Easily it is product of profound changes in the environment. So So we have to, if you want to intervene in the wildlife, like do the wildlife management, so we have to study the disease. So if you only intervene at the time of occurrence of any diseases, we cannot do anything. So this is actually, we have to do this, study the wildlife disease. Next. Okay. So why especially that this is important? Because there are a lot of risk factors. So this is actually not virgin populations. So we are actually facing this animals are actually facing a lot of risk. There are a lot of risk factors. So one is habitat fragmentation and degradation. So because of the settlements, conversion of land, encroachments, sinking of habitat. Next. Then habitat fragmentation degradation due to fire, frequent fire. So every year, like many areas, acres of hectares of habitat actually affecting with the forest fire. Next. Then developmental activities in the near to the habitat or in the habitat actually that leads to fragmentation of forest. Like road, railway, electricity project. There are many developmental projects. Next. Then the tourism and the temple tourism, particularly the temple tourism, that also causing a lot of degradation in the habitat. Next. Okay. So the habitat fragmentation and the degradation leads to congregation of elephants in a year, in a particular season, in a particular places. That actually leads to food competition. So competition among the individuals, stress that may leads to that will increase the predispose the animal for the spread of diseases. Next. Okay. So next risk factors, the cattle grazing or dogs in the fringe areas. So because it became a competitive feeding, it became immediate, become a competitor for our herbivores like elephants. Because if one cattle consume almost the minimum of 12 kg to 15 kg of green fodder. Not alone that, it also will spread a lot of infections. So there will be spillover infection like foot and mouth disease, anthrax, HS. So those diseases actually spill over into the population that will affect the animal. Next. Okay. Then another risk factors are low genetic variability. So actually throughout our India, so this population actually is fragmented, like a large population, central population, south population. So almost more than almost 50-60% of Indian population actually living in the Nilgiri biosphere, in the southern population. Almost 20-21% of the world is elephant population. No, but the diversity in the Nilgiri population is very low. So when compared to other populations, the diversity is very low. Now, recent study indicate that even in the southern population, there are a gap, like Palakkad gap, then Sengotai gap. So there are low genetic diversity in the southernmost of the population. So that also one of the risk factor that may, due to inbreeding, that also may be prone to many other maybe diseases. Next. Okay. Then other risk factors, skewed sex ratio. So, but in most part of the in our Nilgiri Biosphere Reserve in our area now, because of the stringent action against the poaching, now the tusker population, the sex ratio actually come into previously in 2001 to. It was almost like 1:30, something like that. Now it's 1:3, 1:4. It's a good news. But again, now actually due to man-animal conflict, actually many tuskers, many breeding individuals in the prime age actually succumb to death due to electrocution, due to poisoning, due to many other things. So that also one of the risk factors. Next. Okay. Then man-animal conflicts. As I said, the conflict actually it will increase the interbase between livestock and human and wildlife. That actually favor movement of pathogens, spillover pathogens into the population. That actually leads to diseases. Next. Next. Yeah. So this is the situation. Actually, whenever the animal comes out, they're having a lot of interface with the cattle, stray dog, and actually improper solid management. So elephant actually eating plastic weights and cook chicken, sorry, cooking waste, all those things. So that is actually succumb to death. Yes, next. Okay. So other than that, there are actually World Health Organization actually reported that because of the global warming, so this dual diseases actually in the increasing trend. So the prevalence actually increasing. Next. Okay. So now we have to understand before actually going for monitoring a little bit of ecology of the disease. This is ecology. So which is the factor determining the diseases? So there are three factors, mainly environment, host, and agents. This is a triangle, this is a balance. So in a forest, in a particular forest, for the number of hosts, there will be a particular environment. So if there is any changes in the environment, like severe drought or any severe habitat degradation or any other pressure on the environment, what will happen? There will be stress, there will be competition among the host. So there will be agents inside the host. So that agents actually produce the disease that leads to death of the animal. It will come to the balance. That is the actually normal balance that will be there in the population. So what will happen if we alter this triad, this balance? So because of the anthropogenic activities, that leads to disease. So suppose actually we are actually grazing the cattle inside the forest. What will happen? There will be more habitat degradation. There will be more habitat degradation. So there will be competition that leads to disease. So that also is very spillover of infection. So likewise, if we it changes. So based on that, based on the epidemiological pattern, so we can classify the disease into three for our convenience to understand the wildlife management. This one is inherent disease, that is disease of natural origins. So that disease actually it will be there within the system. So as a veterinarian, actually we should understand. So disease also needed. This is also the parasite is also part and part of ecosystem. There are natural diseases. That disease actually needed to control the population. So that the next one is disease affecting different taxa. This is actually spillover infection. So the infection, because of our intervention, anthropogenic intervention, is a spillover into the population. So that actually continuously you have to monitor. Then the next disease, emerging diseases, emerging infectious diseases. That actually diseases newly emerging out in the population. So through proper wildlife health monitoring, so we have to monitor whether the diseases are natural disease or spillover infection or newly emerging disease. If it is emerging disease, why it's happening in the population? So we have to find out the root causes. We have to address those things. The root causes may be environment, maybe habitat, maybe habitat degradation, maybe anything else. So those things actually we have to address. So it's not actually treating the animal with the medicines. So one or two cases, nothing like that. So to intervene into the population, if you want to really do the wildlife health management, wildlife disease management or health management, so we have to monitor those diseases at least for 10 to 20 years, minimum 20 years. Then only we should know where to intervene, when not to intervene. So that is actually most important things. Next. Okay. So there are, for example, there are a lot of diseases. So as far as elephant concerned, almost all the macroparasites are species specific. It's a natural origin. So this grammacephalus in the bile duct of elephants is a disease of natural origin. This is actually needed in the population. It will attribute the ecological attribute of the species. It will decide the dynamic of the population dynamics. It also decide the genetic makeup of the population. So this macroparasite selectively it will cull like young individuals or older individuals or weaker individuals. So this natural origin diseases actually needed in the population. Next. Okay. Next is paraborinema. So this actually a kind of verminous nodules. It will happen in the stomach. This is actually most common in the summer. So this also the disease of natural origin. This is actually needed. Next. The next one is the Cobaldia elephantiasis. Almost we can see this macaques in every case. This is actually this is of natural origins. Next. Okay. Then is anthrax. So anthrax actually it could be the spillover infection from the domestic, from the livestock. So because of our anthropogenic interventions. So that actually we have to do the proper management. So we have to find out, we have to do the proper ring vaccination, or we control the grazing, all those things. Next. Then foot and mouth disease. This is also spillover infection. Next. Okay, next. Okay. Then there is rabies. So we have recorded rabies in Nilgiri Langur, slab bear, jackal, Indian gar. So now really is given in one of slug bear, actually lab identified this as stay virus. So that means the rabies virus spread from this stay dog. So this is also anthropogenic spillover infection, anthropogenic diseases. So next. Okay. The next one is emerging disease. So we know what is emerging disease. So emerging disease, those diseases which have appeared in the population first time, are those diseases which have existed but are rapidly increasing in prevalence and the geographical range at a particular time. So that is called emerging diseases. So almost 70% of the emerging diseases have wildlife component, not like right from SARS, MERS, everything. It's all emerging diseases. Next. Next. Okay. So parabrinema smithi. So now actually this diseases actually these cases actually we are finding in the postmodern more when compared to earlier times. So that means it's emerging out. Some emerging, it's a natural disease, but it's emerging out. So that means something happening in the habitat, maybe stress, maybe weed, maybe habitat degradation, maybe something else. So that we have to find out. Next. Okay, then isopagostom. So this is also very rare, but actually 1 or 2 cases actually we are coming across. This is, even though it's a natural origin, it is emerging diseases due to the macroparasites. Next. Elephant pox. So we have recorded so far only in 24 years, only 1 cases. So, but thing is, it's emerging disease. Next. Okay, so everybody knows elephant herpes virus. This actually may be a natural action origin. So late 1995, actually we recorded actually first case in India 2005 in my camp in one of the elephant cough, captive one cough, Tara. Before that, actually symptomatically identified in some of the cases. Actually previously it's thought that this virus could be spread from African elephants to jump from the African elephants into the Asian elephants, start killing the Asian cough. But here actually we have recorded many cases with Arun Jakaria in southern India. Lot of cases in the wild as well. We have done the phylogenetic study. So we developed a hypothesis that this could be one of the hypotheses. This virus could be evolved from the species. So from the mammoth, the Asian elephants and African elephants actually evolved. So from those time, it may be evolved and mutated, and now it's actually causing the disease. So now actually the prevalence is more in the captive as well as in the wild. Actually, those things actually we have to identify. So what's the root cause? Anything related with the habitat or stress, those kind of things. Next. Okay, then Clostridium. So Clostridium actually due to managemental things. So my friend actually Arun Jakaria and Nilgiri Plateau and Wayanad Plateau actually he also identified a lot of Clostridium pathogens. This is actually more common in summer, mostly where there is a percolation pond. Whenever there was a severe drought, when animal actually eating contaminated water in the pond, it is a soil-borne infection. So actually, thing is, all other diseases actually kill only weaker individuals, but this Clostridium actually specifically we know this kill the healthy individuals. So it's an emerging disease. It may be from nature within the system, but we have to find out. It may be a managemental error, so we have to do the proper research. We have to adjust the management to control these diseases. Next. Okay, next. Okay, so like I said earlier, TB, now one of the most threatening diseases. Actually, we have recorded from 2007. So we have to do proper disease research, and we have to work with livestock department, otherwise as well as with the human health department to control as a one health approach to control this disease to spread into the population. And also we have to properly mitigate human elephant conflict. Next. Okay, so Galangus pernicious in a tiger. So actually, previously before 2007-8, actually we have seen only 1 or 2 cases. Now actually, lot of actually we are going through in the tiger postmortems. So we have actually found only the animal which are stressed which are living in this stressed environment, like close to the human habitation or close to the villages. Now, so properly we have to do the research. Why this suddenly increasing in the population? It's a natural origin, but we have to do the proper research. Whether the population density increased or any stress in the habitat. Why this? So then only we come to know why this is happening in the systems. Next. Okay. Then canine distemper is actually emerging disease, but anthropogenic disease. So in the recent days, actually, we start recording a lot of canine distempers. Like canine distemper in jackal, panther, then many other wild dogs. So this is actually one of the most dangerous things in the population because of this data. Next. Then infectious palant peritonitis. One case we have recorded in rusty spotted cat. So that's also could be a anthropogenic infection spillover from the domestic cat. Actually, we found this cat, one of the smallest cat in our system. The adult itself, it's around only less than 300-350 grams. So we found it was playing with the domestic kitten, and then we reared it, then suddenly it died. So the virus could have been spillover from the domestic cat. Next. Okay. Then we know Kalaivanan forest disease. So it's also emerging disease. Next. And then swine fever, classical as well as African swine fever. Next. Then actually in the recent days, actually we have started recording malignant catarrhal fever, 1 cases in Indian Gar, and there are a lot of cases of theileria and babesiosis in Indian Gar. So that also could be the spillover into emerging disease, but it's a spillover infection from the domestic animals. Next. Okay. So but to understand those things, like we actually gone through a lot of risk factors, a lot of disease actually emerging now. So to address to understand the disease ecology, to understand the disease and do the proper wildlife management, we should have a proper disease surveillance mechanisms to protect our ecosystems. Next. Okay. So here actually for our convenience, I split the wildlife health aspect into 2. One is wildlife health monitoring, one is disease surveillance, other one is prophylactic measures. Next. Okay. So disease surveillance. So disease surveillance first actually there are actually a lot of things, guidelines available from the World Organization for Animal Health, but those things actually directly not applicable into our systems. No, because certain things actually not possible to follow here due to legal constraints and specialties, all those things. Actually, we have formulated specific simple systems to monitor the wildlife health. One is outbreak investigation. So we are maintaining the outbreak report register in the dispensary almost for last 40-50 years. So we going through the fringes areas, consulting with the animal husbandry department, veterinarian, with animal laboratory around the sanctuaries. So wherever there is outbreak of diseases in the domestic animals or in the wildlife, actually we start recording the registers. So that will actually give a lot of information. If it is any outbreak, we have to work with closely work with the departmental veterinarian to do the proper management to prevent the spillover of infection into the wildlife animals. Next. Okay. So these are some of the major wildlife disease outbreak we have reported in India. So we have the record from 1925, like anthrax, rabies, rinderpest, FMD, then HS, anthrax in elephants. Next. So actually, this data itself actually give a some kind of understanding about the diseases in the fringe areas. So which are the spillover infection available in the, existed in the population, what kind of measures, what to do, what not to do. So that actually give a lot of information. Next. Okay. Then next things, disease monitoring, surveillance. This is surveillance. So disease surveillance in the free range, sorry, in the livestock, not in the free range, the fringe areas livestock. So okay. So department actually doing a lot of disease surveillance in the livestock. You know, like there are some for important 7 infectious diseases, right from avian influenza, foot and mouth disease, anthrax, PPR, brucellosis. They are doing surveillance disease. So if there is any prevalence of disease or any outbreak, actually we can get the information from the livestock and we can do the proper action along with the animal department. Next. Okay. Then disease surveillance in the wild animals, the free ranging wild animals. So here actually active surveillance is not possible as like in domestic animals. So we cannot actively collect blood sample, serum sample and do the research. But here actually we have formulated certain guidelines, certain protocols. One is a passive surveillance, opportunistic passive surveillance. So whenever any animal found dead in the jungle, so do proper postmortem, collect the sample. Or whenever there is any sick animal found, so we have to treat it. So those times we have to collect all the relevant sample. Or whichever animal we are rescuing, so collect the proper sample in the rescued animal. Or if we actually found cases like wildlife crime cases, so from those cases also collect the sample and record all the possible diseases. So do the proper surveillance mechanisms. That will actually give some kind of clue, some kind of information. Next. Okay. Then active long surveillance. So here is active surveillance in the sense. So at the disease entry point, actually what we have done actually, here we have found disease some kind of disease risk assessment model. Find out disease entry point in the sanctuary. So based on the road, then based on the livestock population, you know, like cattle, sheep and goat, dog, those things. Then there are the temple tourism, like a pilgrimage. Then livestock, wherever there is livestock industries, wherever there is industrial pollution. So select those points, at least like 8-10 points. Then collect periodical sample throughout the year, like biotic samples, like vectors, fecal sample, soil sample, water sample. So if continuously do this, do monitoring, active surveillance in the disease entry points, that will give actually some kind of clues. So before the disease entry into the core area, that will give some kind of idea, some kind of ideas. So based on that, actually we can formulate the wildlife disease monitoring. Next. Okay. So likewise, actually we have actually platted all those things, you know, like stray dog density, then sheep and goat density in the surrounding villages, then cattle and goat movement. So whichever areas actually through the camera trap, whichever areas actually found cattle grazing in the jungle, or whichever areas actually camera trap photographed stray dog in the areas. So those areas actually we have marked. We have selected some 10 points. So those areas identified, we are cutting active surveillance in the disease entry points. Next. No, previous, please. Okay. Next one is among the disease surveillance of the free-ranging wild animals, that is sentinel surveillance. There are sentinel species. So some species are specific for some specific diseases. So if we monitor those sentinel species, so we can actually screen those animals before actually that virus, that disease spread into the to the human population or to the wildlife. We can identify, we can do the proper wildlife disease management. So like birds for West Nile virus and avian influenza, monkeys for KFD, like wild boar for classical swine fever or African swine fever, for canine like canine distemper, like rabies, those diseases. For rabies, actually there are other carrier animals like rodents, all those things. Next. Okay. Then the fourth one is syndromic surveillance. So actually, if we are actually doing disease investigation in the fringe areas, if there is any outbreak, any suspected outbreak, so same time actually we can train forest staffs for specific symptoms. So we can do the syndromic surveillance like these forms. We can some symptoms not like wound in the mouth, salivation, limping, those kind of things. So based on that, actually we can actually at least we can speculate whether the disease actually spread into the population or animal is health or not or disease. So those kind of symptomic surveillance is one of the aspects. Next. Then the mortality survey and system to report the dead animal sick animal. So mortality survey actually we are conducting the postmortem, we are collecting data, but really we have to analyze those mortality survey. We can it will get some idea. So whether it's a population is healthy or diseased or anything going wrong in the population. So for example, actually we have collected data for last 10 years, from 2010. So average death actually is 110 elephants per year. That means almost 2 elephants per week. But actually, if you go through the media or the newspaper, almost like every day, you feel that every day there is elephant death. Okay, now because 2 deaths in a week. Okay, so because one death actually broadcasted at least 2 days in the paper, then the press media and the WhatsApp group. Okay, but if you analyze those things, whether this death is within the limit or something is alarming. Next, sir. Okay. Actually, if you actually compare with the available population, there are actually the elephant population in Tamil Nadu almost like 3,250 animals. We have year-wise population. If you compare that, so almost this actually death percentage actually is fluctuating. It's not throughout the year, same throughout the year. Actually, it's fluctuating. So once in 5 to 10 years, it's fluctuating. And the percentage also within the normal limit. So like from 3 to 4%. Even if you extra include, like a young calf is difficult to identify, even if you include 1% or 0.5% extra, at the maximum actually 5.5%. So, but here actually when we see that what's the birth rate in elephants, almost like 6-7%. So there is 1 to 2% of birth population growth. That is actually sufficient. So that is actually within the normal limit. Actually, when we have compared with the Dr. Raman Sugumar data, he has a prediction, population prediction. So when compared to that prediction, actually it's well within the limit. Yeah, next. Then actually we can actually analyze what's the different cause of death, what's the percentage of death due to accident, electrocution, natural or disease, those kind of things. That also gives some ideas. So whether there is any dangerous infectious diseases actually spread into the population. Next. Okay. Then the next aspect is a prophylactic measures. Here the prophylactic measures, first things actually we have to identify the various threats, disease risk factors in the population. That may be anthropogenic factors, maybe ecological factors, maybe a socio-economic factors. We have to list out all the risk factors. Then actually we have to formulate disease risk assessment model for each risk factors. Then those things actually we have to incorporate into the population in the wildlife management system. Anyway, actually the department actually having some kind of a managemental system management plan. So on disease aspect, actually we have to analyze those things. We have to assess the risk. Then whichever actually points coming to prevent the diseases. So we have to include those points in the wildlife management plan. Next. Okay. Then address based on the risk factors, we have to find out the risk, address the threats, and work with the stakeholders. There are other stakeholders pertaining to the wildlife management. There are maybe a forest department, electricity department, revenue, health, police. No, actually the major issues actually if you go through actually the solid waste management. This is one of the major things actually that is alarming. Now, because everywhere in the fringe areas, the panchayat actually dumping their waste from the town municipalities near to the forest area. This animal actually coming out and eating, and a lot of animals actually dying because of the infection, because of plastic impacts and of those kind of things. So there are a lot of other things. Because lack of time, I'm not touching, not going through the deep into the subject. So, but we have to work with the stakeholders, even to manage the disease or at the time of outbreak also. Next. Then other things, managing disease emergence, plan to restrict the emergence and transmission of risk at the interface. That is one is immunization of livestock at the interface. So actually we have found around the mice tiger reserve where I am right now I am working. There are 7,000 population of cattle, 70,000 of sheep and goat population, and there are almost 6,000 of stray dog. So we have to work with the animal department. We have to do the vaccination. So that is actually one of the important aspect. So by doing vaccination also, we can formulate other things to restrict the reduce the population and the subsequent. We can develop a lot of other plans also. Next. Okay. So the livestock department itself, they are actually vaccinating livestock. There are actually right now actually in Tamil Nadu, they are vaccinating 8 diseases like foot and mouth disease, PPR, brucellosis, for classical swine fever, lamprey skin disease, HS, anthrax, Newcastle disease, so those things. So here actually mostly they are covering all farm animals, but actually they're not covering the stray dog. Next. Next. Okay. They're not covering the they're not covering the feral dog. So feral dog is one of the major issues. So actually our NTC actually they have given some SOP. So we have to properly implement the SOP, like right from vaccination, then population control measures as well. So because the stray dog menace actually one of the biggest things, not only disease, but also physical damage to the population. Because there's a canine distemper cases, rabies cases, in one cases in Kalaivanan Mudandurai Tiger Reserve. So one slab bear attacked 3 persons. It mauled 3 persons. So that slab bear actually then finally died positive for rabies. So those kind of alarming things actually happening. So I have recorded one case of Nilgiri Langur in Nilgiris, near to Pandalo, those areas. So properly we have to implement this SOP to control, constrain the disease spillover into the population. Next. Then translocations. Actually, we are doing the translocation. Whether we are doing it scientifically, that is actually questionable. Because actually we are capturing a tiger, a panther, a slab bear from the human-dominated landscape, where actually it's living with the human, living with the cattle, living with the dog. We are actually translocating into the core areas. So that may contract some kind of infection, like a canine distemper, rabies, those kind of ICH, leptospira into the population. So then main things is monkey. So actually, in many places, actually people are capturing monkeys from the cities and leaving it in the reserve forest. So that actually carrier for could be the tuberculosis. So likewise, actually transferring the elephants from the facilities, like from temple to camp, forest camp, that also is a danger because more than like 15% temple elephants may be the carrier for tuberculosis because having close contact with the human. Likewise, translocation of deer from the cities, like from Madras or from the deer park into the sanctuaries, that also transmit some kind of pathogens, specifically tuberculosis. So those things actually we have to follow proper IUCN guidelines before translocating those animals. We have to screen it, quarantine, all those things. Next. Okay. Then control illegal grazing and pilgrimage, tourism, those kind of things. So that also it will reduce the interface pollution. It will control the disease. Next, one of the chronic illnesses. Okay. Next thing is now actually the recent days. So the tick population is more the population because I have worked next to Mudumalai. I worked in Theni, close to RF boundary. So in 2012, 13 and all, actually not much. There is not much of a ticks problem even in domestic animals. Now actually after later 2015, the tick problem is more. Actually there actually I used to get the outbreak of anaplasmosis, outbreak of theileriosis, outbreak of babesiosis. So that actually serious things. So we have to do some kind of management. Now actually we have advised at least to farm to prevent spillover of this tick population from domestic animals. I have advised dipping dang in the villages. Okay, So there are some ecological management actually forestry suggested, like pool burning, those kind of things. I don't know how much is possible in the jungle. Next. Next. Okay. Then human wildlife previous, please. Then proper human wildlife to prevent the animal to come out. So it will increase decrease the interface, those kind of things. Then based on the disease surveillance, disease record, we have to form the zonification of the endemic area for formulate specific management. Next. So this are the simple health monitoring protocol actually we are following, even though there are a lot of other things. Like one is in a nutshell, the disease actually parasites is also part of ecosystem. This is also needed. This is actually one of the indicator of the ecosystem health, ecosystem health. So for intervene into the jungle, so whether to intervene, not to intervene, we have a lot of data. So we have to do the proper surveillance. At the same time, we have to do the proper forwarding measurements. That's what I'm conveying in this presentation. I think this is very simple presentation with my little knowledge. Maybe it may be useful for the audience. Thank you so much. Thanks.
Thank you so much, Dr. Kalaivanan, for the wonderful presentation. It was really interesting. You could be able to share most of your experience that you had in the last 27 years. That's great. And I think we have a few questions. And if you have more questions, you can put it in the chat also. This is a question from Dr. Arjun Pandit. And there are two questions. One is, could you please explain the status of cross-infection of tuberculosis in between human and elephant? That is question number one. The other question is there cost-effective treatment protocol against tuberculosis, including duration and cost?
Thing is, there are actually research that the infection from human to elephants, it is possible. But actually, I think so far, with my little available knowledge, I think no record from elephants to human. So actually, the infection actually is possible from human to elephant, not possible to from elephant to human. There are actually treatment protocols available, but thing is, there are actually some constraints. Because we have to give medicine for 6 to 8 months. Even we have treated some 3 elephants in the camp. But actually, those time we have done a laboratory test also that was effective in 3 elephants. But thing is, in some elephants, actually, it's not possible to give medicine for continuous for 6 months or 8 months, because sometimes it will cause appetite. Sometimes the animal actually may be coming to mass. Sometimes elephants may be affected with some other diseases. In those times, actually, we cannot administer the medicines. So in those situations, actually, it will form resistance to that particular medicines. So again, what will happen? The resistant resistant tuberculosis may be spread to the other population or other. That is actually something risky. Actually, there are controversies whether to treat the animals or not treat the animal. Actually, most of the elephants, actually, even if elephant passed for TB from the outside, actually, we could not make, because elephant will be healthy, but it will be positive for tuberculosis. If you open the carcass, you will find some nodules. Yes, sir.
Okay.
I think I have covered the answer a little bit. Yes.
Okay.
Not much, but I have a little bit. Yes.
Yeah. Okay. So you have one more question from Dr. Selvam. What type of treatment is given for blood parasite?
So actually, there is a treatment protocol available for domestic animals. As far as free-ranging wildlife concerned, actually here treatment of individuals is not possible. So only management. So we have to do the proper. We maybe come across with any gaur or any animal coming. You maybe treat 1 or 2 animals. What else? How to treat all the animals? So we have to do the proper management. So if you have to work out why this blood parasites actually appearing in the population, what is the causes? Whether spillover infection or natural infection. If it is spillover infection, how it's spillover, where from, where the sources. So we have to control those things. Only if this is management, not the treatment.
Okay. Yeah, maybe you can just, participants can keep posting your questions, and you have a lot of, appreciations from many people that you can just see Dr. Ganga and Philomeni and so many other people from other countries also. So, in the there is no further questions. If there is anything, we can always email you, Dr. Kalaivanan, and then we'll be more than happy to just, circulate your response to everyone. Maybe we will just send these questions to other also. There are a lot of people will be watching through the recorded videos, so that will be very useful for them as well. Okay, now.
Unless we can discuss in the groups, no problems.
Oh, yeah, we can also discuss in the group as well. Yes. Thank you very much, Dr. Kalaivanan. Now I hand over the session to Dr. Heidi, and then she will introduce the next presenter.